A vac dressing or wound vac dressing is a negative pressure wound therapy device. And what that does is it creates subatmospheric pressure, which is a lower pressure than the surrounding area that we live in. And it sucks the wound together as well as removes any fluid that's produced. So it is one of the most common ways that we treat wounds is with a wound vac. It involves cleaning up the wound first, debriding the wound, and then placing a vac sponge within the wound itself. And then we cover the vac sponge with a clear sticky drape and hook it up to suction. The vac suction devices come in portable, purse-like vac devices that suck on the wound. Then they're battery powered and you can be out and about with them. And in the hospital, they have larger wound vac systems that need to be plugged in, and they usually are mounted at the end of the bed. But otherwise, they work the exact same. They create subatmospheric pressure, which then sucks that sponge down on the wound or within the wound, and it also helps pull the wound edges together. It is one of the best ways to speed up the process of wound healing. Wound vac dressings generally need to be changed about 2 to 3 times a week, generally every 3 days. The one time I will put on wound vacs and I do not want them changed is when I use a wound vac to bolster down a skin graft. So if I have a skin graft underneath the wound vac, I don't want that wound vac changed for sometimes 10 to 14 days, and I will take it off myself. I do not want the wound care nurses changing a wound vac dressing on top of a skin graft. Myself or one of my staff will take the vac dressing off when there is a skin graft underneath it. But that is what a wound vac dressing is. It is a suction dressing that is used to treat many different types of wounds. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.